want to talk about choosing your care provider or place of birth. Early in your pregnancy, this is usually one of the first tasks of preparation for your birth, is choosing your care provider and where you're going to give birth. As a doula, often when either people move into town or they're new to the birth community or birth culture in the area, they often find me and contact me first and ask me for a referral for care providers in the area. So I'm going to talk some about that process and helping you feel comfortable with choosing a provider or a place of birth. So maybe you've already chosen your care provider or a support team, or maybe you're not feeling very comfortable with who you're seeing, or you've not done this yet. It's important to think about your options and different people who can attend your birth. Maybe you're thinking about a home birth. It's important to really think about your surroundings and your environment at home, how you feel when you're at home, if you have other children, or how your partner feels about you birthing at home. It's important to really be on the same page and feel down deep that this is the right place for you to give birth. Ask yourself, am I a high-risk pregnancy? These are questions to ask your care provider, whether it be a certified nurse midwife or an obstetrician or a certified professional midwife. Whoever you're seeing or interviewing, it's important to really ask if you're a high-risk pregnancy, or maybe your pregnancy turns more high risk later in your pregnancy, even if you've chosen a home birth and you're not a candidate for a home birth. As you are interviewing midwives, it's important to think about whether they're a certified professional midwife that do not have a nursing license, and their services may be different than what a certified nurse midwife may be able to give. They're a little bit more limited in their services and what they're able to bring to the home birth. A certified nurse midwife has a nursing license and is able to bring more medical supplies, oxygen for instance. So it might be important to really think about which care provider, nurse midwife, or professional midwife to have support your birth. And all of them may be different, so asking lots of questions, asking about their care of you during pregnancy, prenatal appointments, during labor and delivery, and their postpartum care package, because each of them may be different with what they carry to your birth or the supplies that they offer. So asking lots of questions. Don't be afraid to ask questions in an interview. So whether you interview a certified professional midwife, a nurse midwife, or an obstetrician, it's important to really pay attention to how you feel. Do you feel safe? Do you feel nurtured? Do you feel heard when you ask questions? Let's talk about an obstetrician. Again, it's important to interview lots of different obstetricians or groups if they work in a group. And again, pay attention to how you feel internally while you're at the office, when you're interacting with the staff, when you're interacting with the different care providers. Asking questions and not being afraid to ask questions. How do they respond when you ask a question? I have learned that asking if they work with doulas, if they refer to doulas, even if you are not planning to have a doula, it can be a good question to ask if you want a lower intervention birth. How do they respond? Do you feel like they feel threatened? Do they warmly welcome a doula to be present? I'm a doula, and I know the providers that I work well with and that refer to me, and my clients know that they feel comfortable in that environment, and we all work together. Unfortunately, some providers, OBs, feel threatened, or not necessarily feel threatened, but just feel like that there's not necessary to have a doula present. So that can raise a red flag. If you're wanting a lower intervention birth, maybe they won't be as open to what you desire if they're not comfortable or don't feel it's necessary to have that extra support. So that can be a good question to kind of get an idea of their mindset about birth if you're wanting a lower intervention birth. Also, as you're paying attention to how you feel about the providers that you're interviewing, I've had clients that really want a female provider and don't really feel comfortable with male providers or males in general. And I have worked with male providers that I feel very comfortable with and that I respect deeply. So again, it's important that you interview them even if they're a male or have males in the practice, because you might surprise yourself and really feel comfortable and connect with those providers. Again, it's so important that you really trust that when you go into labor, that the person that is on call or that attends your birth is the one that's supposed to be at your birth, whether it be the care provider, a doula, or a support person, or a family member that you're hoping that will be there. If you're with a practice and there's a group and you are hoping that only one or a few people will be on call, it's hard to control that. So again, as I prepare you for your birth, that's why I focus on preparing internally for whatever arises during birth, because there are so many things that might happen that are outside of our control, as well as the provider that attends your birth, but really focusing internally and really allowing yourself to let go of all those external things, the people that attend, how your birth unfolds, and accept and embrace your labor and pay attention to what's happening right now, and trust that the people are there to support you, that are for you, to help you have the experience that you feel empowered and enjoy your birth experience. If you're planning a home birth, it's important to know the birth culture and also visit the hospital that you may transfer to if that's needed, and understanding the birth culture in the hospital. Knowing their statistics. What is their cesarean birth rate or C-section rate? I like to call it cesarean birth. So whether you're planning a home birth or a hospital birth, it is important to know the different hospitals in your area. In my area, I work in 4 different hospitals, and I know the culture of those hospitals. Talking about the cesarean or the statistics of interventions at the hospital, it's important to think about what contributes to those statistics. There is a hospital in my area that accepts home birth transfers. I am so thankful that they do accept home birth transfers. Unfortunately, most home births, when they transfer, do need a cesarean. And that does skew and increase the cesarean statistic rates in the hospital. But again, I am thankful that they do accept home birth transfers. So think about that and pay attention to that, and not let that be your really deciding factor if it's a higher statistic or cesarean rate than other hospitals, depending on the percentage. So use your judgment and really feel in your gut what you feel is appropriate for the hospital setting if you were to transfer, or if you're planning a hospital birth. I am deeply committed to guiding you and helping you as you are navigating all of these questions during pregnancy and preparing for your birth and postpartum transition. So feel free to post any questions below and find the link to schedule your call with me to ask any questions, and for me to get to know you a little bit and to really help you feel fully prepared for your birth and postpartum transition. Blessings on your journey.